intelligence, is that how do you handle situations that come your way, okay? And that came through just communication, right? It just came through communication. So it was very easy to notice, like, why did that 10-year-old girl say that? You know, her father shouldn't be touching her there, okay? Is this the one that changes it? Oh, here it is. Okay. Okay. Words of comfort, skillfully administered, are the oldest therapy known to man. This is so true. This is so true. Because just that little bit of kindness can go a long way. Some people that you come across, they don't have much kindness or touch or whatever in their families. So they're going to remember you. Children, if you make it a pleasant experience for them now, in the future, they're going to be okay. They're not going to be afraid to have those exams. Only because I gave words of comfort when they were 4 and now they're 6. They're not scared to come into the radiology department. Okay? So, words of comfort are the oldest therapy known to man, and that is so true. Okay, so we have to try to control our emotions. Not only do we have to control our words that come along with emotions, and I'm the world's worst because I'm the type of personality where I hate confrontation. I absolutely hate confrontation. But what happens with that is that if something's irritating me, it builds up into me, and I get to the point where I just blow up. Okay? But I know that about myself. My students, I warn them of that. The very first day of school, I seem like I'm okay. I said, but I can blow up in a second. And I just need for you to be aware, it's nothing personal. It's just me trying to work through my own problems. Okay? So be warned.
Thank you.
You're that way also?
Yeah.
I'll do anything not to have to go through any type of confrontation. Anything. So this is Maslow's pyramid. Now, if you notice at the bottom, this is something that you're going to be dealing with for the rest of your career. Okay? Physiological. That's food, shelter, clothing, sexual gratification. Those are all things that humans need. Our next is going to be safety. Do we feel safe? Okay? So in return, when patients come to us, their physiological needs are already met. But it's up to us to make them feel safe. Belongingness and love. We're human nature. That's exactly what we need. So how do we incorporate belonging and love to our patients? Words of comfort. Okay? Words of comfort. Words of comfort could be just as simple as like, we're going to be laying you on the table. It's going to be kind of cold, but I'm going to give you a blanket to cover up with. If you want to stop at any time, just let me know. You're going to be here for about an hour. Okay? Those are words of comfort. They know what to expect. You're letting them know that their comfort is number one to you. Okay? That makes them feel like they belong. Okay? Self-esteem. Oh, self-esteem. We can't do this to how do I want to word this? Self-esteem to the patient. okay? I'm gonna act confident, okay? Now, if I don't have any self-esteem and I'm communicating with the patient, let me see, where are the gowns? Okay, put this gown open in the back. Did I tell the patient to get undressed? Okay, so she's gonna say, or he's gonna say, everything? Do I have to take off everything? Okay, where if I have a lot of self-worth, I'm gonna say, I need for you to take everything off from the waist up and put this gown open in the back. If you need help getting it on, please just let me know. Because sometimes those gowns are hard to put on. They can get tangled up. Some of the gowns have 4 holes in them. It's a wraparound gown. You put your arm in, you put your arm in, it wraps around, and you put another arm in. So that's 3 holes. Okay? If I have someone that's 80 years old, they're used to the old gowns. They're, you know, where you just put it on and tie it in the back. Okay? So if I communicate with my patient with a lot of self-esteem, I know what I'm doing. I'm confident in what I am communicating to you. I'm confident in the exam that I'm going to do on you. That's going to, again, make the patient feel confident that I know what I'm doing. Just by communication or just by actions. Need to know and understand. When you talk to your patients, you're going to be very direct. And they will do anything that you tell them to do. Anything. So I have a story about that. I love hairy-chested men. Okay? I just love, I love a hairy man. Okay? It's one of my things. So, what do? Even if I don't have to have my patient take off his shirt, if I see hair sticking out, I'm going to have him take off his shirt. Okay? Because he's going to do exactly what I tell him to do. Okay? He's not going to question that I need for you to take everything off from the waist up. Because he has on a t-shirt, I can very well just do my chest x-ray through the t-shirt as long as there's not a whole bunch of, what is it, silk screen? The emblems, because sometimes that ink shows up. Okay, but if it's just a plain white t-shirt, you know, you can do a chest x-ray with that. Okay. Because he has a hairy chest, I'm going to have him take off his shirt. Because he's going to do exactly what I tell him to do. He's not even going to question it. Okay? But I don't have to tell him, oh, I see you got a hairy chest. You know, let's go ahead and take your shirt off. Because I'm confident in what I tell him. I know my personality. I need you to take everything off from the waist up, and if you need help tying the gown in the back, please let me know. Okay? Now, a lot of times, if it's a man, I'll undress them in the room. Okay? I'm going to do this. I'm going to be doing something else. I'm going to be cleaning something else. I'm going to be looking at my request. It says, so you're my patient. Go ahead and take everything off from the waist up. If you need help with your gown, I'll be right here. So it says here that you've been having a cough for about 3 months. So 9 times out of 10, she's going to go ahead and get undressed. Okay, because I've already directed her to do that. But I'm giving her privacy because I'm turning around. Now, if that was a woman, I would probably go ahead and put her in a dressing room. Okay? Aesthetics, what do you think aesthetics mean?
Cleanliness of the lab.
Huh?
Cleanliness
Correct.
of the lab or the room.
Remember how I told you? I make sure that I have to do nothing once I bring my patient into the room, because I've done it all before I brought the patient in. Okay? I know that I've got my sheet there, because if I have to, if I lay down or if I lay my patient down, I always cover them with the sheet. I like to be covered with a sheet. I don't want to just be laying there. I want a sheet over me. I'm going to make sure I have a pillow. I'm going to make sure I have my sheet. I'm going to make sure I have my gown. If I'm doing an upper GI study, I'm going to make sure that everything that I need is right there and ready to go for my upper GI study. Okay? I don't want to have to leave the room. I want everything right there. Because 9 times out of 10, I'm going to say, we're going to be doing an upper GI on you today. That's where you have to drink the stuff. And this is the stuff that you're going to drink. It's called barium. It does constipate, so you want to make sure that you drink plenty of water afterwards. Okay? It's kind of chalky tasting, but it's nice and fresh, and I just made it this morning. Okay? Self-actualization. How would you interpret that? How would you interpret self-actualization?
Confidence.
Confidence. Exactly. Okay? Because we've all met those people that you want to finish their sentences for us, right? What do you think about those kind of people? I get kind of irritated with them myself. You know, because, like, speak. Let's get it out. Let's just speak. Okay? Here it is again. It's just a little bit different PowerPoint, so that way you can kind of see how it is. It's exactly the same, and it's called Maslow's hierarchy. Okay? That's the name of it. If you see this in any shape and form, it's always the same. Okay, patient needs. When your patient denies using drugs or alcohol, ETOH is alcohol. Okay? ETOH is alcohol.
What does that stand for?
Ethyl something, I don't know, somebody got their phone on them? Abbreviate ETOH.
Ethyl alcohol.
Just ethyl alcohol? Okay.
It's E-T, or lowercase t, and then capital O-H, so it's like, I think the actual.
Ethyl alcohol, okay? Okay. So, there's this cartoon going on Facebook right now, where the guy, you know, he obviously looks drunk. You could tell his eyes are kind of wall-eyed, and he just got that. He goes, I'm not slurring, I'm just talking in cursive. Okay? You can tell when a patient is under the influence. Okay? You can tell that. Especially if you work in the 11 to 7 shift on a Friday or a Saturday night. About 2 o'clock in the morning, that's when you start getting the car wrecks come in. Okay? Story. I was working at an imaging center, and when I came in, I went and I got my patient. I brought her back, got her completely undressed, and she was for an IVP. An IVP is where we inject something into a vein, and we look at the function, how fast the kidneys fill up with this contrast, and it's a time limit. We take post-injection 3 minutes, 5 minutes, 7 minutes. I don't even know if they do them anymore, okay? So, when I brought her in, her eyes were like saucers, okay? They were like saucers. I said, did you have anything to eat or drink today? And she said, no ma'am, I haven't. But when I laid her down on the table and I went to inject the contrast, her arms were black and blue. I didn't say anything, but she knew what she had done. And so she said, I know, I was really, really nervous about this exam, and so I did a lot of drugs last night. I said, so what's your drug of choice? She said, methamphetamine. I said, so really, how long has it been since you've been able to have anything to eat? Was this just last night that you did this, or was it yesterday, or has it been the last couple of days? Because methamphetamine, it it's gonna affect my body, okay? So that is something that I would have to tell the radiologist, because if my kidneys aren't functioning the way that they should, there's got to be a reason why. Okay, so I felt like that it was important that I find out when she started injecting and when she stopped. Does that make sense? Yes.
Is that to ensure the functionality of the kidneys?
Yes, it will.
Okay.
Okay.
So like if, whether or not to use contrast, or if the contrast is able to be flushed out after?
Yeah, well, I didn't know whether it would or not.
Right.
So I went and talked to my radiologist.
Yeah.
You know, because I mean, her arms, they were just black and blue where she had been injecting drugs. So I don't want to put contrast into her body if it was going to harm or contradict what she had already been putting in her body.
Right.
So I asked the radiologist. The patient has been injecting methamphetamine, and I don't know if it's safe for me to inject the contrast. He goes, well, I'll go and talk to her. Mainly, he wanted to see what she looked like, what kind of person she was, and he wanted to finally kind of get the story. Because he can talk to the patient and find out more information than I would ever go into that level with.
Is,
Okay, because he's a doctor. Yes.
is there a specific reason for that, or is he trying to build his own thing for like?
Yeah, he's got to figure out what he's going to say whenever he dictates.
I see.
Okay.
So it's not just like, oh, if they're this type of person, I'm not going to treat them.
Oh, no, not that
I
way.
was like, that's
Because he's got to figure out what's going to happen whenever he dictates.
Right.
Because is it going to be? He ended up having to call faculty. He had to call someone else to find out if it was safe to do the contrast. Because she had just already done that morning, around 2 o'clock in the morning, and then she was with me at 7 a.m. Okay, so she hadn't been to sleep.
Ma'am,
So he made the call to find out if it was safe or
ma'am, is the supervisor your radiologist?
not. Okay, so this is the way it goes. I'm the technologist. He's been here 20 years, has 20 years experience. He's my supervisor. We all answer to the radiologist.
I see. So you're skipping him and you're coming to me now? When
Yeah,
you find
I'm gonna go.
So you,
Okay,
or
because-
you go through him to
No,
me?
I didn't. Okay, because I felt confident enough to go straight to my radiologist.
And he's also present in the...
Because why would I want to get my supervisor involved with
See?
someone that is abusing drugs?
Right.
Okay?
So you need someone who has the, not necessarily experience. but-
Confidentiality.
Right. The,
Okay? That was my choice. Okay? Now, if I would have had a reaction, I would have gone to my supervisor, and my supervisor would have contacted the radiologist, because I wouldn't have been able to leave my patient alone.
right. Or reaction being, I'm sorry, did you?
No, go ahead.
It could be something like an anaphylactic shock where
To
they
the
just
contrast
completely.
because they didn't let you know prior.
Yeah.
Okay. Is that something that you would have to let the authorities know? Like, hey, you know, either they didn't tell me or they
No,
did tell me.
I wouldn't do
So
that.
that's a breach of
Yeah,
confidentiality?
that's a breach of confidentiality. But if she would have died on the table, then the police are gonna be involved.
Well, yeah, but they would have to test for other things, like obviously
other
you didn't
things.
kill her. So,
Yeah.
um,
But because I injected the contrast, that could have gone along with it.
Okay.
Okay, does that, it's a real fine line.
Yeah.
It's a real fine line. You were gonna ask a question?
Yeah, if the minor is being abused and being touched, you tell your senior? Your
I tell my
supervisor?
supervisor.
Not the radiologist, right?
No, he has nothing to do with it. I tell my supervisor because they're the ones that are gonna contact the correct department. Okay? My radiologist isn't gonna know that department. My supervisor is. Okay?
So to backtrack to the use of contrast in a patient? Like,
Yes.
we do blood tests to ensure that their kidneys and livers
Correct.
and stuff work. Okay.
And that's called a creatinine.
Creatinine test.
Okay. If you're gonna inject contrast, like for CAT scan or it's been so long since I've been in the radiology field that IVPs and sialograms, I don't even know if they do those anymore, where they inject contrast in through the gland underneath your tongue, and then they take pictures of it as it travels. I don't even know if they do that anymore. But they do blood tests to be able to see if your body's gonna react or not. They also have contrast that doesn't have iodine in it. Okay? So that's gonna lower my chances of having a reaction. Normal reactions are gonna be nausea and hives. Those are gonna be the normal reactions to a contrast that we put into the patient's bodies. Okay? So if you see a patient like this, they're on something. Okay? So, women, go and get one of your male student cohorts to go with you in there. Don't be in the room by yourselves with this patient. Men, get a woman. Get one of your fellow students. Don't be alone with someone that looks like this. Why? Because it's your word against mine. And if I say you touched me, who's gonna win? Patient.
So
The patient will always win.
it's better to have a witness of the
chaperone.
opposite. Okay.
Yeah. It's better to have a witness in the room with you, kind of like a chaperone. Okay?
Does that exclude?
If you're,
I'm sorry.
go ahead.
Does that exclude the radiologist or technologist?
Oh, no, I've had to go get radiologists before.
Okay.
Okay? There was no males in the department. Okay? Everybody else was busy, so I went and got a radiologist. Can you come in and sit with me while I do this exam? But why? And I said, because I'm afraid of him. I said, he seems to be a little bit too touchy for me.
Is that something we use a walkie for, or telephone, pager, something of that nature? Like, or do you just leave the patient and go get them? Because I remember you mentioned.
No, I just left the patient
Okay.
because the radiologist was right next door.
And they're not in the room by themselves. You're more so like in the trying to get them situated, and then you go.
Yeah.
Okay. So they're never left.
I can be in the middle of an exam, and if I get uncomfortable, I'll be back in just a minute.
Oh, I thought you said you weren't allowed to leave. Like
No, you can leave.
Okay.
Yeah, you can leave. Depending upon the situation, you're
Right.
gonna have to use your common sense.
Right.
But if I have a patient that's touching my leg while I'm doing the exam, I'm gonna stop my exam and I'm gonna go get a chaperone. Okay? Am I gonna go and do my supervisor? Yeah, if my supervisor's available, yeah. Am I gonna file charges against the patient? Absolutely not. Would he file charges on me? Absolutely. Does that make sense? Take care of yourselves and use your common sense. If it says, remember we talked about the good angel and the bad angel? If this angel says, oh, it'll be okay, he won't touch you again, or she won't touch you again, because men will do it just as much as women. If this one says go and get someone, go and get someone. Learn to listen to yourself. You were gonna say something?
Yeah. So you said you wouldn't like press charges or anything like that. What if the situation escalates? God forbid, the situation escalates to that point where you would want to press charges as the, medical. Like, let's say they just go past assault into harming you, like.
Yeah, my supervisor would handle that.
Okay.
They would tell me which direction to go.
Okay.
Like if I got pinned into a room and them holding me down,
Yeah.
it's something,
Like you
we're
could
gonna
pursue
call
legal action.
security.
Yeah.
Security will handle that.
Okay. But you wouldn't just let that go. Like you would try to take action.
No, because if he
to
did
protect
it to me, he's gonna do it to someone else.
Right.
Mhm. Okay? If something happens, yell for help, go for help, your supervisor, anybody that's around, and security can come. Okay?
What
I have a
is that?
story about this one.
Code red or code green?
Huh?
Is that one
I wouldn't
code-
call it code. Okay? I wouldn't call it code. Why? It's gonna bring in a whole bunch of people. Do I want everybody in this room, this guy touched my breast? No, I wouldn't want everybody in the room to know that the guy touched my breast. I'm gonna have someone come and talk to him. You don't touch my breast. Okay?
I mean, we could take the badges off and we can handle it, but
Yeah, but we can't. There's all kinds of different ways for you to handle a situation that has gone bad. And they're going to happen to you guys. They will. I've been in the field for 54 years. I can't even begin to tell you all the situations I've been in. And they were all handled differently. I never handled each situation exactly the same. Okay? If your supervisor's not there, you go get the next person in charge. That's your radiologist. Okay? It's our job to interact with the patients effectively with the least amount of time. Because even though we have patients, our supervisors are all about numbers. Okay? So I want to go from this patient to this patient to this patient and this patient as effectively and as fast as I can. Okay? So say I have a job. Okay? You do 3 patients in an hour, I do 15. I am working more effectively than you are. Now, it might have been a bad day for her, and she wouldn't get counseled on it because your 3 patients took a lot of time and they were sick. But normally, you do 15 patients in an hour also. Are we gonna do 15 patients? No, that's just a number I pulled out. But because I did 15 patients and she did 3, I had to pull the slack on hers from her exam, even though they were scheduled for her room. I was free to do it. Why? Because she had a patient that was an altered state. She was just unlucky that day. Okay, she could have had someone that was mentally challenged, physically challenged, someone that was on drugs, someone that comes in drunk. Okay, those types of patients take more time because you have to speak very precise. You have to have a lot of patience. Okay? You might tell them to lay on their back and they're going to lay on their stomach. No, not on your stomach. I need for you to lay on your back. And then roll up on their left side. No, I need for you to go ahead and lay down on your back. I need for you to lay on your back and I want you to look at the ceiling. And then they'll roll back over on their stomach. Okay, you're going to have patients like that. It's completely out of our control. Just be patient. Keep repeating until you get what you need. Okay? Yes.
would that be something we document? Mr. Fong mentioned something about how his technologist once upon a time would just document everything.
Yeah. And if she's got to say why she only did 3 patients and I did 15.
Right.
Okay? The easiest documentation, patient unable to cooperate. Okay? You don't have to be specific. Just say patient unable to cooperate. Okay? Also, the patient might have refused the exam, because they can. They'll come all the way to the hospital, they've waited 3 months for the appointment, they waited 3 hours in the waiting room, you bring them in, you explain their exam to them, they say, I don't wanna have that. I'm not gonna do that. Well, you try to explain why they need to have it. Okay? Sometimes you might have to go get your supervisor, or you might have to go and get the radiologist to talk to them again. Or you might just be one of those sonographers or technologists that say, okay, they refused it, let's go to the next patient. Okay? But if you know by the diagnosis what you think might be going on, and you think that it's imperative that they have the exam done, I'm going to try to talk them into it. Say, well, you've already waited 3 months for the exam. Okay, you've been having symptoms now for almost 4 months. Let's just go ahead and take these 6 images, and that way you'll be done, and the radiologist can read them today and get hold of your doctor today, and the doctor can give you a call and give you a diagnosis. Because I'm going to write on there, patient apprehensive, please call physician. Okay, I've covered myself because I've already told my patient the doctor will read it today, and I'll have him call your doctor today so you can get the exam done. If that doesn't work, I'll take the requisition into my physician, and I'm going to say, I can't talk this patient into the exam. Okay, they're just too apprehensive. I can't, yeah. He'll either call the doctor or he'll come and talk to the patient himself. Okay? Because radiologic technologists, they're imperative for the diagnosis of imaging. You know, everybody that goes into the hospital, almost 100% of them go through some type of imaging. Okay? So it's important that we know what we do, how we treat our patients, because it's a very, very small community. Okay? If you have a reputation of manhandling your patients and being kind of ugly to them, Herman's going to know, Methodist is going to know, St. Luke's is going to know, Southwest Memorial is going to know, because it's a very, very small community. And you're going to find that out. Of course, if we have a patient that's cooperative and easy to do, we love those. We call those walkie-talkies. Okay? Because they do exactly what we tell them to do, and they don't ask any questions, they just do it. Okay? So when we first meet the patients, we're kind of already going to know about what's going on before we ever call the patient. Okay? Because I've already looked at my requisition. I've already either read my requisition or I have initialed the chart, because we write in a chart and we initial when those exams are done. So we put our initials and the date. Okay, that's the only thing that we can write in the chart is our initials and the date. Okay, so we kind of already know a little bit about what's going on. Now, am I going to go into Epic and look at all their history? Absolutely not. They call that breaking the glass. Okay, because I'm looking at information that doesn't pertain to this exam. You can lose your job, okay, if you break the glass. For instance, Tom Cruise shows up at my hospital. Well, I want to know what happened to him. He didn't come to imaging, but I looked. If I look, I lose my job. That's breaking the glass. Okay? So my initial, I already kind of know what's wrong with my patient before I ever go and introduce myself or I call the patient into my room. Okay? After I work effectively and I set up my room, I've already got all the information into the computer so I can do my exam. Then I'm gonna go out and I'm gonna call my patient. I'm gonna check the identifiers. I've learned from my mistake because of the beautiful woman that stood up with the scrotal exam. I'm just gonna call the last name. Okay? And then when they stand up and they come towards me or I go to them, I'll say, state your full name and your date of birth. Or if it's an outpatient, some facilities will give you an armband for outpatients and some facilities won't. Okay, yes.
Would it have been rude in that case if you asked, would you prefer, ask them what they prefer to be called?
No. Would it be rude?
Was not professional?
I know in the book it says Mr. and Mrs. But this book was written before the pronouns hit the system.
Yeah, so that's maybe
Okay.
like now with pronouns and stuff.
Yeah, I would be a little bit leery about that.
I feel like they would put that in the chart, like,
But you
my
don't have a
last-
chart, you just have a requisition.
Well, like as a patient form that whatever they're filling out, don't they have a, like your gender and then what you prefer to be?
I think now they do that.
Yeah.
I
That's what
think
I'm
now they
saying.
do that. You know, cause,
To avoid that.
okay,
so.
to avoid that. Now, me being old school, I probably wouldn't even look at that column. Because I'm not used to looking at pronouns. You're either a male or a female. Okay, for me. Of course, that's my own bias, because that's my generation. Okay, so my patient comes in and I introduce myself. I explain the exam to them. I instruct them on what I need for them to do. I instruct them on how long they're gonna be there. Do they need to use the restroom first? And after they get dressed, I'm ready for my exam. Okay? Other than that, I'm never gonna say their names again. Okay? I'm just gonna say, I need for you to take in a deep breath, hold that breath in, hold it, hold it, hold it, hold it, breathe. Okay, you can go ahead and breathe. Now turn your body to the left side. Let's take another image of your chest. Take in a deep breath, hold it, hold it, hold it, hold it, and breathe. And you're all done. Okay? We're gonna go ahead and let you get dressed, and it's about 48 hours before your doctor gets the report. You'll get in touch with your doctor. But I really wanna know what it says. We can't say anything like that. We are not doctors. If you say, well, you know, your arm is broken, that's practicing medicine. Okay? They can tell by looking at their arm that it's broken, especially if it's deformed or if it's a compound fracture. They know it's broken. We can't practice medicine. We can't give those reports. Okay? So, excuse me. So when you talk to your patients, make sure that you have good verbal communication. Sorry, my knees hurt today. I'm gonna sit down for a minute. Okay, so this is your, just an example of what you might see. So here it says, the patient details, that's usually going to be their name, okay? Hospital, they're gonna tell you what floor they're from. Clinic, they're gonna tell you what clinic the order came from. Who the name of the doctor is, the doctor's address, most of these are gonna be blank. Medical record number, contact number, oh, look at that trolley. What does that mean?
Wheelchair.
Just a stretcher. okay? And we're gonna show you how to maneuver stretchers, how to get around with that. Whether they come with a chair, whether they're walking, whether they're portable, and, if they came from an ambulance. Cause some facilities, you'll have to take people that came from an ambulance first. Okay? Some facilities. You're gonna wanna know when their LMP was, if it's a female. Because if they're childbearing age, then they have to have a pregnancy test before you can do their x-rays. Okay? Why did they go to the doctor? Okay? Did they go to the doctor just for their routine checkup? Okay? But then their liver function tests were elevated? It's gonna say increased LFTs. They went to the doctor and this is what they found lab-wise, and now we're following up on that. Okay? What else is up there? What they're having done, X-ray, ultrasound, CT, MRI. Y'all know the differences between all of these? Ultrasound uses ultrasound waves. CT is ionizing radiation. MRI is magnets. Okay? You'll have to go through MRI. I think y'all should have already filled out that form to let us know if you have tattoos or if you have any kind of implants in your body. Have y'all done that yet?
I don't think so.
Okay, sonography did. Okay, so you're gonna go through MRI safety training, probably sometime this semester. Okay, because there's certain things, there's different zones that we have with MRI that, you're not allowed in. Okay?
So for those individuals with tattoos, do they have special things that they need to wear, or?
You don't go in there. Some tattoos, they have a type of ink that, is reactive to the magnets. Okay? Is the patient a diabetic? Do they take metformin? Especially this is important for CT. Okay, because I'm not gonna do a contrast, I'm gonna use a different type of contrast if my patient is on metformin. Okay? Does my patient have renal disease? Well, I'm certainly not going to inject contrast if my patient is in renal failure. We abbreviate renal failure as RF. Okay, you'll see that everything's got an abbreviations on your requisitions. Okay? Then you have your doctor's name right here, and a lot of times, how we can get in touch with them. You might work at an outpatient facility where it's your job at the end of the day to call the doctor and give them a verbal over the phone. Okay? Does that make sense? Okay. Every facility and every organization are different. Like you might take a 2-view foot at this facility, but you'll take a 4-view foot at this facility. Okay? You might do a 2-view chest at this facility, but a 4-view chest at this other facility. It's all different. Those are called protocols. Okay? If you work in an outpatient center where you never know what you're gonna do next, your radiologist might ask you to fax these reports, but call the doctor and give a verbal. Okay? All different things. An inpatient and an outpatient, those are different. Inpatients, they come from the hospital. They have spent the night in the hospital. Okay? If they're coming from the emergency room, they're called ER patients because they haven't spent the night in the hospital. Okay? Inpatients come from the hospital. They always have an armband and they always have a chart. They always have an armband, they always have a chart. Okay? I love this cartoon. Mr. Griswold, you don't have to dress for dinner. An outpatient, they've made an appointment and they come to you at a specific time. Okay, like when you go to the, outside facilities, those are all outpatients. Okay, like Valbona, Strawberry, Casa, Smith. We call those are walkie-talkies. They walk into your room, they walk out of your room. They're able to give good communication most of the time. Interacting with patients and friends. Okay, so with the way medicine is now, I would never send my mother to the hospital without me being there. Because I'm going to be my mother's advocate. My mother's not gonna speak up. She doesn't feel good. She doesn't want to go to the emergency room. I made her go to the emergency room. I'm gonna speak up for my mother. If my mother goes by ambulance and they take her off the stretcher, she doesn't have a sheet on her, they move her to the bed in the emergency department. They're busy trying to get her stabilized, but as soon as they get her stabilized, I'm gonna ask for a sheet. That's not being overbearing. I am my mother's advocate. Okay? So, I'm not gonna get in the ER team's way. I'm not gonna over talk. I'm not gonna ask questions because they're all flitting around trying to get my mother stabilized. Okay? But in return, because I gave them respect, they're gonna give me respect and they're gonna say, well, we've already done a urine culture on your mother and it looks like she has a UTI. But we're gonna go ahead and do a CAT scan because you said that she has a little bit of a dementia. Because in older people, a UTI does cause dementia. It's one of the things. My mother got up that morning, she couldn't remember how to make coffee. Something is wrong with my mother. I call the ambulance comes and gets her and takes her to the hospital. And so I'm gonna follow the ambulance there. I'm gonna meet her there. Okay? So we have to pay attention to the family members, especially if we have a child. If we have a child, then we don't want to jerk the child out of the mother's arms and take that child into an examination room. I'm gonna invite one parent, not both parents, one parent. Okay? Now, if the father wants to go and he's adamant and the mother says, I'm going, and the father is adamant he's going, am I gonna tell the father, no, you can't come?
You have to let them figure it out.
Huh?
Would you let them figure it
No,
out?
I'd let them both come. Okay? Now, if it's adamant that my policy is that only one parent comes, I'm gonna go to my supervisor. Let my supervisor tell the dad he can't come or the mother she can't come. That's not my job. Excuse me.
So we operate under like the handle or hand off policy. Like, I don't know if we use that in this workplace, but like at Lifetime or other places that I've worked, they say either you handle it if you can, or you hand off if you.
Correct, correct. I'm gonna try to do it on my own, but if it doesn't work, I'm gonna get my supervisor. Story. So, we had a female, excuse me, that came to the hospital and she was pregnant. Okay? At that point in time, whenever I was working, no one could come in. Okay? No one was allowed in the examination rooms. And they're just your patient. Well, the father was adamant that he wanted to go in. okay? So my supervisor wasn't there, so I had to go to administration to find someone to talk to the father. Come to find out, she was human trafficked, okay? That's why he didn't want her to be in the room by herself, because he didn't want her to tell me that, help me, I'm in trouble. Okay? And things like that happen. Okay? I was scared of him. You know, when he told me he was going, and I just brought him into the room with me. And I said, go ahead and get undressed, and go ahead and get yourself comfortable, and I'll be right back. Well, I went straight to administration. I said, I need help. My supervisor wasn't there. The radiologist was at lunch. So I went to administration. I need help. So someone came to help me.
To which
It
they
was
got
out of my hands.
security and-
Huh?
To which they got security and whatnot.
I don't know what they did after that.
I hope so.
Yeah, I don't know what they did. Because I didn't go in the room with them,
Right.
okay? Because as far as I was concerned, it was out of my hands. Whenever I brought administration in there, I was done. And I wasn't gonna go back into the room until administration says it's all clear. Okay? But come to find out, she was human trafficked. Okay? So you never know what you're gonna have outcome. Because why? He was abnormally rude. He made me feel very anxious. I was concerned for my safety. Okay? When that good angel says, hey, go get help, you better go get help, because something's gonna happen. Okay, yes.
It's 11:10.
Huh?
11:10.
Okay, yeah, it's 11:10. I think she, oh, yeah, let me go find out if she's done. Let's take, what time's this class over? 11:45? Okay, let me go find out about Miss Adger.
What was
She
the
might
word
still
again?
be in the lab. Give me 5 minutes. Y'all wanna go to the bathroom?